just started actually putting shots in arms 2 days ago. I submitted that application, I want to say it was maybe 3 weeks ago. So it was, as far as things like this go, lightning fast to get it put together. So just over the last couple of weeks, we actually got our vaccine supply just last Wednesday. So less than a week before we started. And I actually had the freezer in possession about a week and a half ago. So everything happened really quickly once the state said that we could go ahead with it. And they've been great too. They're obviously kind of developing things on the fly too. But they've managed to help us out quite a bit, and we were able to get it done, so we're all excited. We're using the Moderna vaccine, and we did have a little bit of option to decide between that one and the Pfizer vaccine, but because of some of the storage requirements, that ended up being really the best one for us, and so we were really glad that they were able to get Moderna in our hands. So far, we've been really fortunate. The first 2 days, we've hit it right on the nose and came out with just enough. We didn't really pre-plan for that. What we do is towards the end of the 5 hours that we're doing the vaccines, we look at how many doses we have left. We're kind of locked into 10 doses at a time because each vial has 10 doses in it. So if we have a couple, 3 extra, what we'll do is call a few employees who are on the schedule for the next day and say, hey, do you mind coming in today and getting it done? And our goal would be not to waste a single one. So far we've done all right, but we're only a few days into it, so we may have more of a challenge another day. We did vaccine clinics for the flu vaccine the last couple of years, and so we had a little bit of a baseline knowledge and some processes in place. This was a different situation for us because we weren't as much in control of how many doses we had and when, and some of the storage requirements and some of the scheduling requirements, because we really used the state's database for all the scheduling instead of our own internal process. So we had to learn some new software and learn some workarounds in order to get things done on what we call Sweetwater time, which is a little bit quicker than maybe the state would do things. But it's actually been a little bit of an adventure, and it's gone really well.
And how's the state been to work with?
They've been fantastic. They've been super responsive. We have kind of a team of 2 or 3 people that we worked with throughout the last week and a half, and then we have a specific contact person, and she's back to us via email within a few hours if I have a question, and we have her cell phone. If, on day one, if we had some horrible thing that we didn't know what to do, I could call her. And so she's been fantastic. I think considering how much they've been up against trying to get a lot of places up and going, and particularly last week they had a lot of universities and colleges that were interested in vaccinating. They were really focusing on that. But I was getting emails back in the evenings because they were putting in long hours as we were. So I think it was a good team effort. I'm just really grateful that we're able to do it here. We've had a lot of people, I wouldn't say we'd have a lot. We've had a few people ask, like, so am I going to be required to get a vaccine here? And we feel very strongly that that's not what we would require. This is really optional. And the only reason that we decided to have it here really is because Chuck wanted it to be as easy as possible for the people that wanted to get the vaccine to get it without interrupting their day or having to take off work. And so it's really worked out well. I think everyone's really happy about it.
They had offered it much sooner than I was able to get it. I would have had to wait about another month for the shot, and once they opened it up, I jumped at the opportunity to get it done sooner.
Pretty convenient for you?
Very, yes. Able to just get up from my desk and come down and take care of it. Was
there any hesitation on your part to do this?
No, not at all. I'm grateful to get it as soon as I did, and anxious to get the next one.
My job and Nurse Beth's job has really changed over the last year. Usually we would be seeing 20 to 30 patients in the clinic for any number of things. Once that shutdown happened, then we had to kind of reset a little bit. We didn't want to have people coming in that were sick because we didn't want them coming in to the campus where our office is and exposing other people. And we didn't have access to all the personal protective equipment and testing that we would have needed to evaluate them. So unfortunately, we had to pivot a little bit and start really just pre-screening all of our appointments. We did have a process in place for people to schedule online very easily and get in pretty much the same day, and we had to take a step back and have them email us and make sure they weren't unhealthy before they came in. And then we really shifted our day-to-day process to just really managing a lot of email. Anytime someone in the business is out sick, they email us to run it by us just to make sure they're safe to come back and when. And then when we have someone who has COVID, we jump right on it and do the contact tracing that the health department was doing originally, but just got a little too overwhelming. And what we found is that we could get that contact tracing done within a matter of hours instead of them getting a call the next day. And so we really developed some internal processes to track everyone who's out sick and figure out when they're safe to come back, and then a good way of, even if it requires looking at our video internally because they maybe don't remember who sat at their table for lunch a few days ago, and we can find that out. So it's really been a team effort, not just with, Nurse Beth and I in the clinic, but with security and the managers and everything to have these processes in place, and really to do our best to keep all of our employees as healthy as we can and to keep spread as much as we can out of the building. And they've been super patient with it. I just couldn't be happier with how well everyone is rolled with the punches. It's been an interesting year.
Sure.
That's a great question, because you hear a lot on the news about there's a lot of B1.1. Whatever numbers, and they're hard to keep track of.
Sure.
And it's really been fascinating to kind of follow that, because a lot of it depends on what country it's popped up in, how many people have it, what the viral burden is throughout the population. And some of the news is reassuring and some of that is concerning. And the best that we can at least tell our patients right now is we don't know for sure. And so that's kind of where it comes to, if someone's having suggestive symptoms, we still want them to stay home even though they're vaccinated, until we're able to get the dust to settle a little bit and make sure that it isn't maybe one of those cases that either slipped through that 5 or 8% that got vaccinated, or it's maybe a variant that we haven't come across yet and it's not quite as well covered. So we still follow that guidance, and it can be a little frustrating when you're sick and you have your vaccine and we still say to stay home, but we also try to explain to our employees that we want them to not pass any kind of illness on to their coworkers. Otherwise their coworker then has to figure out what they've got too. And so we still stay really aggressive with that and try to work individually, which is great that we can do that here because we have close contact with all the employees and help them walk through that. The guidance from the CDC is really pretty specific about how well protected they consider you to be. So after that second vaccine, what we'll tell people is after 2 weeks, after they've had that second vaccine, then they can assume that they're more or less immune. There's still, about a 5 to 8% chance that someone can get COVID despite the vaccine, so we're careful to explain to them that, if they get a bad cold and they lose their sense of taste or smell, don't assume it couldn't be COVID just because they had a vaccine, and we would want them to get tested. But then if someone maybe has a cold and they're off for a few days, we may not make them stay home quite as long as we would otherwise if they don't have a negative test necessarily. And it just makes it a little bit easier for them not to have to quarantine if they happen to get exposed to a family member or a friend, at least for 90 days. Right now the CDC says 90 days after that second vaccine, you're considered immune, that you wouldn't have to quarantine. I'm hoping they're going to change that after that 90 days is up when they have more data. But as of right now, that 90 days is as long as that automatic kind of assumed immunity works. We believe, based on the numbers that we're seeing, that it maybe is going to be longer than that. In fact, almost certainly. But we're going to assume that 90 days to start with for now until the guidance changes, because that's what we're sticking with.
And when do you think maybe things are going to get back to normal where we're not?
Oh my, I wish I knew the answer to that. Don't we all, right?
Sure.
There's no question there's quite a bit of optimism that maybe we're turning a corner. And I think it's really anybody's guess whether this becomes one of those things where it kind of fades into the limelight and we don't hear about it much, or whether it just is something that simmers for a while. And honestly, I'm not trying to be political in saying this, I just wouldn't speculate because I just don't know. I think that we have a little better handle on how to better protect each other with regards to some of the distancing and some of the face masks for people that have not been vaccinated. And it's a complicated problem. There's really no simple way, and unfortunately everyone has a right to their own opinion about it. So finding that common ground for everyone is always going to be a struggle. But I'm optimistic that we're going to be able to have our outdoor events and concerts and things like that even this summer, at least on a smaller scale until we get more comfortable with it. This is maybe just more personal, but I'm just really grateful for all the employees and team members that we have here who have just been super patient through what's been a really challenging last year. Business here has been super brisk, because a lot of people are at home, and who has a lot of time on their hands doesn't want to work on learning to play guitar or learning to play keyboard. And so, we've benefited from that, and our employees and their families have had to struggle through, being here at work and working hard, and during a difficult time. And sometimes when Dr. Todd gives them a call and says, "Oh, unfortunately, we found out that you've been exposed and you're going to need to stay home," they've been gracious, and for the most part, everyone's really worked together and we've had very little people giving us a really hard time. So I'm really grateful for that. It's made our jobs a lot easier.